Okay, here we go. Hello, my name is Lori Keister. It's nice to meet you today.
Hello, my name is Amy Setoff, and I will be the interviewer for your interview today. Sit down and have a seat.
Okay, thank you.
First of all, we might as well get off to these few questions we have. What are the areas of nursing you're interested in and why?
I'm very interested in personal direct care, one-on-one setting. I am interested in the elderly. That way I would, because I do have an interest in working with the elderly, in working with the mentally challenged people.
Well, tell me a little bit about your clinical experiences and what rotations do you enjoy most and why?
My clinical rotations were anywhere from OB/GYN through med-surg, psychiatric nursing, up to the critical care and open heart surgery. The ones I really enjoyed most, I think, were the psychiatric nursing and also the one-on-one patient care I was able to give in the ICU and the heart unit.
Okay, then let me ask you this. What was the biggest mistake you ever made and how was the problem resolved?
I think the biggest mistake that I have ever made so far, when I was passing out medication in the hallway, we pour the medications before we go into the client's rooms, checking out the MAR, had all the medications correct, went into the room to verify the 5 rights, and I noticed that the medication that I was going to give to a certain resident, that was not the resident. So I was able to rectify the situation, not give the medication, and get the correct dosage that certain resident needed.
Well, then tell me a little bit about yourself. What do you see as your strengths and why?
My strengths, I feel I am a good team member. I work well with others, patient. I am able to perform most any task that is given to me. I have no problem in any assignment that I get. If I am not able to do something, or if I don't have enough information, enough skills, I will not hesitate to ask those that are more experienced than I am.
Well, then what about your weaknesses?
My weaknesses right now, I think I am not quite assertive enough in certain situations. I do need to take more of an assertive role, more of a leadership role, especially becoming a new RN and transitioning out of that role of an LPN.
How would your most recent nursing instructor describe you and your performances in a clinical setting?
I think my instructor would be very pleased when told about my clinical experiences. I was able to take on at least 2 patients at a time, very willing to accept any assignments, did everything that was asked of me. I was able to learn to improve my evaluation and assessment skills, and able to look for any small changes in that person's health and behaviors that would affect their medication or any of their problems that they would have.
Okay.
Treatment.
Tell me about your challenging clinical assignments and what you learned from it.
I had very challenging clinical assignments the last part of the semester. I was in the heart unit. These patients were brought directly from heart surgery. They were intubated. They had many drips going, chest tubes, catheters. They had to be direct one-on-one care for the first few days that they were there, monitoring the heart rate, all the drips, everything that was going into them, the feeding tubes. So it was a very time-consuming, and it was something that you really had to watch for any changes in order to adjust any of the treatments that the doctors ordered.
What kind of skills do you feel that you have gained from your past experiences?
I feel that I have gained quite a lot right now. I'm able to do more, especially with infusions, giving medications through the IV, through pumps, use of vents, starting IV lines, also collecting blood samples, especially from the frail, the elderly, people with small veins that are usually hard sticks, because you don't want to stick them a lot and cause any kind of bruising.
Okay, very good. Now tell me a little bit about yourself. How would others describe you?
I feel they would describe me as someone that is eager to learn, very dependable, someone that does need to be a little more assertive in different situations, but someone that does not back down from a challenge and will kind of have their back in any situation needed.
Where do you expect to be in the next 2 to 5 years?
Well, what I'm looking for is a place that I can hone my skills, learn from new experiences, learn from experienced nurses, look into bettering my assertiveness, my leadership skills, and becoming able to provide a lot of direct one-on-one care with my patients.
We do not have any openings at this present time in the areas which you suggested you have interest. Would you be willing to accept a position in another area?
Yes, I would be willing. I would need to know, of course, where it is, exactly how far it would take me to get there, what skills I would need, what all the job entails. But yes, I would be very interested in learning more about any other kind of job openings.
Okay, now tell me about a time when you had to establish priorities during one of your clinical experiences.
Well, actually, this wasn't too long ago. In my clinical experiences, I had one of my patients up on a bedpan, on the bedside commode, and you have to be very careful. You don't leave them by themselves when they're going. And then, a code was called. They needed all available personnel, all available nurses there. So instead of leaving my patient there, I had to call for the nursing assistant, let them know where I was going. I needed to go to this code, and then to make sure that they sat with the patient at the bedside commode, because you don't want to risk any falls or any problems, and that to let me know how things went.
Okay, now tell me about a time when you went out of your way to assist a family member or a patient, although you really didn't have time.
Well, the unit that it was on, unfortunately, we did have a lot of unexpected deaths. With the heart unit, we did have a patient that came in for what was a valve stent to the heart, just what they call an ordinary, no complication, hopefully surgery. But instead, there were many complications. The patient ended up dying. So it was an unexpected death for the family. And even though we don't have a lot of time for consoling, for questions, you always want to make time for that patient and for that patient's family.
Well, very good. Now we don't have any more times today, but thank you for your interview, and we will notify you when the time comes to see if you qualified for the position.
Okay, thank you very much. It was very nice meeting you today, Ms. Satoff.
It's nice to meeting you too, Lori Keister. Bye.